But tonight's top story is a big health scare. Thanks for joining us. I'm Tom Shad. An employee at a local food packing plant has tuberculosis, but it will be weeks before a full health department investigation is complete. Then at your side's Brandy Cummings just got back from Smithfield. So Brandy, you went to find out how other workers may be affected.
Yeah, Tom, tonight health officials are working to ease fears that even as they wait on test results, just to see how many others may test positive for TB. Officials with the Department of Health have launched a large-scale investigation at the Smithfield packing plant. That after one worker tested positive for tuberculosis.
We will determine where they work, look at their workspace, see how close, coworkers are to them, see how the ventilation system is in the room.
Health officials were alerted of the case during the first week of October. Since then, the infected employee is no longer at the plant and co-workers are being tested.
Well, at this point, we are concentrating on the people that are most at risk, these close contacts. TB disease is not something that happens in a day, week, or month. It takes some time to develop.
Spread person to person through the air. Someone with an active form of tuberculosis can have symptoms that include cough, fever, weight loss, chest pain, and sweating at night.
Because TB, if you have someone who's infectious, does take a prolonged exposure in kind of a closed, space like a classroom or, office type building for you to become infected.
An employee gave 10 on your side this letter from the company. It shows the infected employee was working in the Smithfield North plant. It also tells workers health officials would be talking directly to employees who are potentially at risk. For others, health officials have this message.
At this point, it's just good to be aware of the situation, and if the situation warrants it, the investigation will be expanded to include others that potentially could be at risk.
The health official I spoke to tonight explained that they've done skin tests on the employees that are most at risk. In another 8 to 10 weeks, they'll do another skin test to see if those results have changed. Live in the newsroom, I'm Brandy Cummings, 10 on your side.
And a spokesperson for Smithfield Foods sent us a statement saying that they were aware of the employee being treated for symptoms, but the situation poses no food safety risk. Read the full statement on wavy.com under this story.